I am Ruth with ARC Seminars, and I want to thank you very much for your interest in our webinar called Cancer Care, a Collaborative Approach. So in this first video in my series about this course, I'm going to give you a really great overview of what you're going to get out of this webinar. I'm going to tell you why you need this education in your life right now. So what we do first is we dive a little bit deeper into the 5 most common types of cancer. And after we do that, you are going to come away with a better understanding of how the signs and symptoms of those cancers and also the side effects of the treatments that these patients might be receiving will really affect your care that you're providing. You'll also come away with a better understanding and a better appreciation for the fear and anxiety that these patients and their caregivers feel throughout the whole process that they're going through, from receiving the diagnosis to deciding on treatment to the after effects of everything and how it affects their family, their social life, everything. And I like to include the clinicians as well in that clump of caregivers. There can also be a lot of fear and anxiety that we experience when we're going into treat a patient that maybe is more fragile than we're used to treating, or that we're just not sure of what their prognosis is going to be. So, we teach during this course, we teach strategies and different techniques on how to better educate the patients and their caregivers, and then also in turn ourselves, and teach strategies for coping with what's going on all throughout the continuum. You'll also learn during this course that, although we as therapists, we always want to be getting people better, getting people stronger, the goal of care when you're working with a person with cancer is not always rehabilitative. So they may be at a stage in the disease process where the goal of care is more palliative, or the goal of care is more end of life. And it's important for us to understand that we can still play a part in whatever stage that they're in. We would just formulate our goals a little bit differently. So we talk a little bit about that, and then we also talk about, how if the goals shift with their care, somewhere in the middle, then we also have to shift our therapeutic goals so that we are always in alignment with them. So just, check out more information about it on our website, and then I will also put a link directly to the webinar below this video, and just stay tuned for more great information about it. All right, thanks.